Good morning to Abdiel, to everyone who makes possible this broadcast, to the sign language interpreter, and the audience tuned in to this briefing. We start today's press conference by recalling an important historic event that at the time filled us with grief. However, it reached an international significance, mainly for Latin America and the history of Bolivia. A group of guerrilla men who were fighting for the liberation of Bolivian people were imprisoned and others were killed. Commander Ernesto Che Guevara was taken to quite a remote and nearly unknown place called La Higuera, where he was brutally murdered. His remains and other combatants were found by a team of experts and professionals, including Dr. Jorge González from the Cuban Ministry of Public Health, and today rest in Villa Clara's mausoleum. I reiterate, today's date is remembered worldwide, but along with this tragedy was born the strong certainty that Che Guevara's ideals will be honored by all generations. That said, today we report 4,940 hospitalized patients, 735 are suspected cases, 3,784 under medical supervision, and 421 are confirmed active cases. Yesterday, 7,132 samples were processed at the molecular biology laboratories all over Cuba, and now more recently also in Ciego de Ávila. As a result of the analysis and processing of these 7,132 samples, 19 people tested positive for COVID-19. This brings the total number of samples processed since the pandemic began to 670,744, of which 5,917, or the 0.88% of people, have been diagnosed with the virus. Samples from all of the country's provinces were tested. Pinar del Río processed 224, Artemisa 91, Havana 4,805, Mayabeque 245, Matanzas 161, Cienfuegos 105, Villa Clara 300, Santi Spiritus 614, Ciego de Ávila 394, Santiago de Cuba 68, and so forth from every Cuban territory. The 19 people diagnosed yesterday are Cubans. There are not imported cases. The source of infection linked to one patient is yet to be determined. Hence, the figure stands at 35 patients over the last 15 days whose source of infection is being investigated. 18 of the 19 cases are confirmed case contacts. The 91.8% of all diagnosed cases in Cuba have had contact with someone who had previously tested positive to the virus. Therefore, this represents the most important risk group. They all are promptly isolated and treated in order to confirm or rule out the disease. As I mentioned, none of the patients contracted the disease abroad, what accounts for 446 imported cases. 10 patients are male and 9 are female, for a 51.1% and 48.9% respectively. Of the 19 patients, 12, or a 63.1%, were asymptomatic at the moment of the test. This figure therefore means that a 61% of all diagnosed cases in Cuba did not present any symptoms while being tested. That is a 68.1% over the last 15 days. 6 individuals are under the age of 20, of which 5 belong to pediatric ages. What stands at 658 diagnosed patients under the age of 18, the 90.9%, or 598, are discharged and recovered from the virus. 5 patients are between 20 and 39 years of age, 5 between 40 and 59, and 3 patients belong to the 60 or more years of age group. Of the 19 diagnosed cases, 11 are from Havana, 4 from Ciego de Ávila, and 4 from Santi Spiritus. In Havana, the 11 cases belong 5 to Arroyo Naranjo, 4 to Centro Habana, 1 to Playa, and 1 to Marianao. In Santi Spiritus, the 4 patients belong 3 to Santi Spiritus and 1 to Trinidad. In Ciego de Ávila, the 4 diagnosed cases belong to the municipality of Ciego de Ávila. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants over the last 15 days continues to be the highest in the country. It has slightly decreases to 56.51 though, followed by Santi Spiritus, higher than the day before, with 30.48. Havana's rate decreases to 9.84, a figure below 10, what shows that we are on the way to achieve control over the disease, although there's still a great spread in the province. Mayabeque comes next with 2.08, similar to the day before. Matanzas and Artemisa have lowered their rates to 1.53 and 0.78 respectively. Villa Clara with 0.26, Pinar del Rio with 0.17 and Camagüey with 0.13 remain with similar rates compared to the day before. This indicator allows Cuban authorities to place each province within the different stages and phases of the pandemic. The provinces of Holguín, Cienfuegos, Las Tunas, Granma, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality remain free of COVID-19 cases over the last 15 days, and in some territories even 1 or 2 months. Therefore, Cuba reports a rate of 5.72 per 100,000 inhabitants, lower than the day before. With this analysis, of the 5,917 diagnosed patients in Cuba up to date, 421 are hospitalized active cases, that is the 7.1%, of which 419, or the 99.5%, are clinically stable. We did not report any deceased patients today, hence the figure of COVID-19 fatalities stands at 123, for a mortality rate of 2.07%, lower than the global rate of 2.92% and the regional rate of 3.31%. I always mention the 2 patients evacuated at the start of the pandemic. Yesterday, 50 patients were discharged from hospital, a positive indicator concerning discharged diagnosed cases ratio. The 50 patients discharged yesterday belong 1 to Artemisa, 22 to Havana, 2 are from Matanzas, and 7 from Ciego de Ávila. Thus, it accounts for 5,371 diagnosed people in Cuba recovered from the virus. 1 patient is reported as serious and 1 reported as critical, both of them hospitalized in Villa Clara. Another patient passed from serious to being closely monitored. We would like to inform the population about the deceased for COVID-19 of 4 Cuban medical collaborators who are providing health services in other countries. They did not belong to the Henry Reeve International Brigade, but to the group of over 29,000 doctors who bring sanitary assistance in the poorest regions of the world, accounting for 48 countries already. We offer our condolences to their family and friends. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 324,713 people were diagnosed with the disease yesterday, for a total amount of 35,848,269 diagnosed cases. 5,783 fatalities were reported yesterday, what brings the global death toll to 1,048,181 and the mortality rate to 2.92%. The Americas region continues to be the epicenter of the pandemic, with 17,445,693 diagnosed cases, of which 125,694 were reported yesterday. Therefore, it stands at a 48.66% of all cases worldwide. 2,801 people died for COVID-19 in the Americas yesterday, what brings the regional death toll to 578,079 and the mortality rate to 3.31%. The United States continues to top the list of the worst affected countries by the pandemic, with over 7,501,000 diagnosed cases and nearly 211,000 fatalities, followed by India with 6,757,131 COVID-19 cases and 104,555 fatalities. Brazil reports nearly 5 million cases and Russia 1,273,504. Turning the attention to the most affected countries in the region, after the United States and Brazil comes Colombia, Peru, Argentina, Mexico, Chile, Canada, Ecuador, Bolivia, Panama, Dominican Republic, Guatemala, Costa Rica, and Honduras. As you can notice, Honduras is now placed in the 15th position. Cuba occupies the 21st position in the Americas with 5,917 diagnosed cases up to date. Mexico continues to report the highest mortality rate in the region with 10.36% and Ecuador with 8.24%. This is all the information on the behavior of the pandemic in Cuba and the world.